Okay, so what does a surge in vaccines and a drop in new cases mean when it comes to our battle against COVID-19 now and in the months ahead? We have a lot to discuss. Joining me now, Dr. Adam Kassam, who is the new president of the Ontario Medical Association. Good morning to you.
Good morning, Melanie. How are you?
I'm doing all right. And first, I want to note you are the youngest and first Ismaili Muslim to be president of the OMA. So this is a huge milestone. So congratulations to you, and well deserved as well, because I know a lot of your colleagues speak very highly of you. So congratulations.
Thank you so much, Melanie. Let me maybe start off by saying that it is an incredible honor and privilege and responsibility to be the president of the OMA. You know, over the past 14 months, we have all seen the incredible dedication and sacrifice that Ontario's doctors have made in the face of the pandemic. And when I'm reflecting on the past 14 or 15 months, whether it's in the ICU or in the ER, with our doctors helping to keep sick COVID patients alive, or public health doctors helping us to manage the spread of the disease, psychiatrists helping to help patients in increasingly frequent mental health crises, or family doctors helping to mass vaccinate our population. This has really been an all-hands-on-deck approach for our profession, and I couldn't be more proud of my colleagues.
Yeah, very well said there. I want to get your take on, you probably heard our sound-off conversation here about whether or not people are feeling a bit more positive. The lowest case count that we saw since, November, so over 7 months. Vaccinations are going up, case count going down. Do you see this trend continuing? How are you feeling as a medical professional when you see those numbers?
Melanie, I'm really encouraged by a lot of the numbers that we're seeing. As you're saying, we're getting more vaccine. We're putting more of those in arms. We're seeing case numbers go down. We're seeing people hopefully turning the corner here in terms of being able to go outside and enjoy the outdoors, just like this past weekend, which was incredibly hot here in Toronto. And, you know, I think we are cautiously optimistic about the future. I think one of the major concerns that we all have, I think, is trying to get fully vaccinated, because we know that two-dose schedule and the importance of having 2 doses in arms is extremely important, as we're seeing around the world. And so while we're turning the corner, I think we still need to keep our eye on the ball in terms of making sure that we get vaccines in arms.
As we look to turn that corner, I know the OMA was outspoken in their recommendation to open up schools. So we know that's not happening for the remainder of the school year. But now, as we look to potentially opening up for step 1 or stage 1 of reopening a little bit earlier than next week, what do you think should be kept in mind, and what is the OMA's position on what some of those thresholds should be or could be?
Well, I think what we look at, generally speaking, is healthcare capacity. What do our ICU numbers look like? What do our hospital bed situation look like? And I think that as we are seeing those numbers decline in the ICUs, they're being decanted. We're seeing lower case numbers. I think that we are optimistically ramping up services in other areas that are non-COVID related. So we know that the backlog of care that has exploded, unfortunately, because of COVID, needs to also be addressed. And I think that a combination of all of those factors makes us positive for the future. But we really need to be vigilant with getting 2 doses in arms.
Okay, so let's get back to the eligibility. So obviously it opens up, it expands today. Would you like to see it speed up even more? There was some criticism earlier about it. You know, it was only at 80 plus and that they should have opened up 70 plus even earlier. I know some public health units expedited that process ahead of the province. Do you think that this process or protocol that we are on right now is working for rolling out dose number 2?
I think that, as you were saying, Melanie, having a local and regional approach to this that is really governed by the medical officers of health in these jurisdictions is really key. They have the data, they have the real-time information about what their case numbers look like. And, you know, in order for us, as we are seeing in other places around the world, as far as the Delta variant is concerned, we really want to make sure that that folks are vaccinated, fully vaccinated. And so if we can start rolling that out quicker, if we can start saying, hey, you know what, we're going to perhaps reallocate to places where there is an increasing need. I think that we saw that work in the first go around, or at least that was what the design was, and I think that would be a reasonable strategy for the future as well.
Okay, a lot to consider here. Dr. Adam Kassam, we appreciate your time. Thank you so much.
Thank you so much, Melanie.
Hopefully we'll have you back on here in the show shortly. 7:11 is your time right now. We're going to check back in with Dina and Sid. Good morning.